Hi, I'm Dr. Ernesto. I'm the developer of the S.M.A.R.T minimally invasive bone grafting technique. S.M.A.R.T stands for subperiosteal minimally invasive aesthetic ridge augmentation technique. It is a patented method that includes surgical instrumentation and devices as well. Today we're going to discuss one of the most interesting and unique applications of the S.M.A.R.T method, and that is the treatment of implant bone dehiscences. So what are dehiscences and how were they treated? A bone dehiscence is a situation where the implant is missing bone in one of the surfaces. On the left side of the screen, you can appreciate a CT scan of an implant that is replacing an upper front tooth. And you see there is a arrow pointing to the surface, which we call the labial surface, meaning facing the lip, where bone is lacking. And this is a common finding. The traditional method including detaching the gums, elevating what is called a flap so that the area can be exposed, the surface of the implant cleaned, followed by then the addition of a bone grafting material, and subsequently a membrane is used to cover the particulate biomaterial. Then the gums have to be placed back in its original position and sutured. The problem with traditional GBR type of surgery is that it does not yield predictable aesthetic results. As a matter of fact, there are a number of papers that show that advanced reconstructive techniques, particularly GBR, increases the risk for complications and compromised aesthetics, resulting in less favorable aesthetic outcomes and also exhibiting a high complication rate of about 75%. Depicted on the screen right now is a case where multiple procedures were done as a result of failures. So there's two stages of implant placement and also of bone grafting. The first phase failed, and there are a number of subsequent procedures, and every time another procedure is done, it results on the type of soft tissue disfigurement that you can appreciate on this photograph. How is S.M.A.R.T different? We start with making a small incision that is placed remotely from the site that's going to be treated. Then, using a combination of laparoscopic principles and specially designed and patented instruments, we create a tunnel that provides access to the surgical site. Subsequently, a combination of biomaterial and growth factor are introduced into the site. Flaps are never elevated, meaning that the gums are not detached away from the bone and they don't need to be repositioned. No membranes are ever used. There are no bone blocks utilized or any other type of autogenous graft, meaning that we don't need a donor site. We don't have to go elsewhere in the body. All the biomaterials that we use for the procedure are off the shelf. There are no screws or metal meshes, and the bone surface remains untouched. It is not prepared at all. One of the reasons for the predictability in terms of results is the use of a biomaterial that provides dimensional stability in combination with a growth factor. The growth factors will activate stem cells. It'll promote graft integration, resulting in a natural wound healing process. It's just as it occurs in the body. The treatment of implant bone dehiscences have been unpredictable, both in terms of regenerative outcomes and in terms of aesthetics as well, often resulting in exposed areas of the crowns of the implants which are objectionable. As a result of this, most clinicians have stopped trying to treat these type of problems. S.M.A.R.T provides an alternative to treating these implant bone dehiscences without the aesthetic risk. As an example, we have this case which was referred to our office from a prosthodontist practice, and the patient here has had this implant restored for many years. Her complaint stems from the fact that, to quote her, it feels funny, but more importantly, aesthetically, it bothers her because she has a high smile line, she's an attractive lady, and you see that there's a concavity and a darkness to the gum tissue that is not acceptable to her. If we take a look now at the CT scan images, once again, there's a dehiscence on the labial surface. And this is a common finding, often caused by either placement of the implant or bone remodeling. Using the S.M.A.R.T minimally invasive approach, we're able to regenerate the buccal plate and provide a substantial amount of bone volume, as well as meeting the patient's aesthetic concerns in a procedure that takes under an hour under local anesthesia. If we furthermore follow this patient over a period of 3 years, you'll see that the amount of augmentation has basically been maintained. And that's a result of using the combination of the dimensionally stable biomaterial and the growth factor. This is another case where a pre-existing implant presented to our practice with basically the same complaints. A vague discomfort in the area upon touch, upon pressure, and also the fact that those threads were visible. So once again, in a risk-free procedure in terms of aesthetics, with local anesthesia and under 1 hour, we're able to regenerate a substantial amount of bone on the labial surface of that dehiscence. Yet another case, this one, the courtesy of Dr. Greg McKenzie, who is a periodontist in South Carolina. And he provided this case 1 week after taking our course. To us, it's a source of pride and satisfaction because we have streamlined the educational process and the training during our course to make sure that it is clinically practical as much as possible and that clinicians are ready to implement this technique the week after taking our course. This is another case where the patient was unfortunately subjected to a traumatic event while in college. This is again a pre-existing implant, but you can see that utilizing our minimally invasive approach, we can, even in a posterior area, overcome the access limitations and provide the patient with an alternative that both gives him a biologic and anesthetic solution as well. Now, pushing the envelope a little bit, this patient had an implant and the restoration completed approximately 3 years prior to presenting to the office. And his chief complaint is the fact that this gray area of the implant is showing. We call this the implant platform and also parts of what we call the abutment as well. So once again, we utilize our minimally invasive technique, and you can see now how the amount of bone that was missing has been replaced as well. Over time, what will occur is that the soft tissue, the gum tissue, will remodel. It will thicken many times, it will creep up, so that we actually will not only preserve the appearance of the gum tissue, but in many cases enhance it as well. 2 years later, we can confirm with the CT scan that the regenerated bone volume is being maintained. We have several human histologic specimens that give us a good idea as to how S.M.A.R.T works. The ones on the screen are organized in sequence, so you can see that we have them from 2 months to 14 months, and they give us an idea of how these grafts actually heal over time. We also have histologic information as to how the graft heals in contact with the implant surface. This provides proof of principle that our methodology works. In conclusion, the S.M.A.R.T minimally invasive bone grafting method is the only predictable alternative for the treatment of implant bone dehiscences that preserves aesthetics and avoids complications. There are certain factors that may affect the outcomes. Number one is operator variables. So you need to get trained. This is a technique-sensitive method, and the training is crucial. We do not make the instrument kits available without the proper training because we are seeking the best outcomes both for patients and for our colleagues. Another issue is patient compliance, and another one is obviously healing ability. There are hundreds of thousands of implants with bone dehiscences that have gone untreated because the traditional techniques have been ineffective and caused tremendous aesthetic problems. We have the solution now. If you're interested in learning about it, please contact us, call us, send us an email. If you want to find out more about S.M.A.R.T and see more cases, you may visit our website, www.smartbonegraft.com. If you're a patient and you have an implant or several implants that have lost bone or lacking bone, please contact us as well. We have a nationwide network of 400 certified clinicians that can help you. This is Dr. Ernesto Lee once again. Thanks for viewing. We'll see you next time.